cause of irritable bowel syndrome isn't well understood. It is a common disorder that affects the large intestines. The International Foundation for Functional Gastrointestinal Disorders has designated April as IBS Awareness Month. During this time, the IFFGD works to focus attention on important health messages about IBS. Symptoms include abdominal pain, bloating, diarrhea, and constipation. Some people can control their symptoms by managing diet, lifestyle, and stress. Others will need medication. The specialists at Advanced Gastroenterology and Surgery Associates explain how they diagnose and treat IBS.
Irritable bowel syndrome is a pretty common problem. A lot of patients coming in, they complain of abdominal pain. So they have different presentations. You can have irritable bowel syndrome with constipation alone, or strictly diarrhea, or a combination of both, constipation and diarrhea. So it is a disease that diagnosed by the process of elimination. So you have to exclude all the other possibilities. Once nothing else to explaining their symptoms, then you can conclude that it is irritable bowel syndrome.
The one good thing about irritable bowel syndrome that I tell patients is that it won't kill you. You may feel as though you're dying, but you're not. If someone has chronic abdominal pain associated with changes in bowel habits, and it's been going on at least 3 times for the past 6 months to a year, then you can, by what's called the Rome criteria, diagnose them with irritable bowel syndrome. Now, of course, these are patients without warning signs, meaning no weight loss, no poor appetite, no blood in the stool. But it has to be abdominal pain associated with changes in bowel movements. And then, if everything else is there are no other warning signs, then you can make the diagnosis of irritable bowel syndrome. There are many various things that potentially could cause it. Stress. Patients usually have more stressful situations when they get their symptoms.
FODMAP diet, a diet that we recommended to patients that has irritable bowel syndrome, that have constipation. So these food items usually create a lot of gas and can cause a lot of discomfort to these patients. I do have a list, and I just print it out and give it to the patient, and I ask them to eliminate these food items. And usually it takes 1 to 2 weeks for them to see the improvement from that.
Patients who have the diarrhea predominant type, you want to check for things like celiac disease, just to make sure that's not playing a role. And there are many medications out there that we use to try to control the symptoms, but there's nothing really curable. Since the advent of the probiotics, they have helped a lot in controlling a lot of symptoms, especially in someone who we think there was a triggering factor from a virus or antibiotics. We know that the colonic bacteria is very important, so replenishing the good bacteria in the colon is crucial.
For more information, as well as the testing and treatment options offered at Advanced Gastroenterology and Surgery Associates, please click on the IBS Aware Story link icon on our homepage, yourhometownhealth.com.